Hey folks, this is Seftap Savaş and this is our conversation. Today I'm recording this short message from my own yard because nature is so beautiful and don't mind the grass not cut. I'll get to that sometime. So you may remember last time we talked about the hereditary cancers. So these are the types of cancers that increases the risk of developing cancer quite significantly, sometimes as low as maybe 40 to 60%, sometimes as high as 100%. So, as I said, we were going to continue this conversation because it's really important. Around 10 to 20% of all cancer cases are supposed to be or likely to be hereditary in nature. So, it's really important to know family history, types of cancers, diagnosis, age of diagnosis, and so on, to and inform those or bring this information to your family doctor and physician and nurse practitioner so that they can actually have a good understanding of your risk and estimate your risk and then can hopefully follow up you with appropriate timing and type of screening services as you would like and based on your risk. Now, one thing that has come to our attention, and this is sometimes we hear it, but it really is sad, that sometimes it looks like the physicians think that you may not be at high risk of breast cancer, for example, if your mother side doesn't have breast cancer. Now, this is not true. Um, this implies that the breast cancer risk or hereditary breast cancers are X-linked or mitochondria, and I'll get to that some later, don't worry about it. But oftentimes this is not the case. It can come from either side of the family. So if you have a parental side of the family affected by breast cancer or maternal side of the family affected by cancer, and with multiple cases, early age of cancer, and etc. It doesn't really matter like which side of the family. So you may still be at risk of increased risk of breast cancer. So this is something for our physicians as a reminder. And likewise, a person, for example, who has got prostate cancer, which is usually the cancer of the male sex. Yeah, again, it doesn't matter from your parents' father side or mother side. You can still be at risk, depends on the other risk factors. So this is a good reminder for our physicians, healthcare providers that in certain cancers, it doesn't really matter which side of the family is affected. Individual can still be at risk. So please, try to remember this fundamental and sometimes critical information because sometimes it just means the patient's symptoms are dismissed, and sometimes that may mean late diagnosis, more significant treatment, and maybe even worse outcomes and early death. So our patients deserve better. I know as physicians you also deserve better. This is some reminder. Please consult your medical geneticist colleagues or the textbooks or other guidelines. And I'm pretty sure from there on you can take it. So until next time, folks, thank you very much. Bye bye.